congestive cardiac failure. So, it is not really a heart failure as people mostly put it. However, in this condition, we are concerned with the congestion. What brings about the congestion? What is the result of this congestion? Now, to define what congestive cardiac failure is, it is a condition characterized by the inability of the heart to pump enough blood to all body organs and tissues, resulting in what? Venous congestion and insufficient blood supply to the what? Various parts of the body. Heart failure, in other words, is a condition in which the heart has lost the ability to pump enough blood to the body's tissues. With little blood being delivered, the organs and other tissues do not receive enough oxygen and nutrients to function properly. So, in this condition, just as I've said, the main aim is the congestion, which brings about insufficient blood supply to the vital organs. Okay? So, there is congestion somewhere which we are going to explore more, which brings about the insufficient supply of blood to body organs. Now, a question that you may ask is, what are the characteristics that can make us to recognize that this is congestive cardiac failure? So, we talk of distended jugular vein, pulmonary edema, dyspnea, to mention but a few. However, as we go on, we are going to dig more about these characteristics. Okay, so before we look at the signs and symptoms of congestive cardiac failure, let us first of all look at the pathophysiology so that we understand how the manifestations, how the signs and symptoms come about. So, of which we are seeing that the failure by the heart to pump blood out of the heart sufficiently to all parts of the body will result in congestion in the ventricles. Now, as this is happening, it will lead to backflow into the atria, the resulting of this congestion in the in the veins. So now, for the left ventricle, there will be pulmonary congestion, which will lead to cough, dyspnea, and pulmonary edema. Whilst on the right side, there will be congestion in the veins. Okay? So now, this congestion in the vein will account for the distension of the jugular vein. The increased venous congestion will result into seepage of fluids from intravascular into extravascular, causing edema. Now, the reduced cardiac output will also lead to reduced renal flow. The reduced renal flow will result in reduced glomerular filtration rate, which will now lead to the release of renin, which is both an enzyme and a hormone which regulates blood pressure. Renin will convert angiotensinogen to angiotensin 1. Angiotensin 1 will be converted to angiotensin 2 with the help of angiotensin converting enzyme. Aldosterone will also be released in the process. Now, the combination of the two processes will be called renin-angiotensin-aldosterone system, which will produce two effects. The first one being vasoconstriction, and the second one being the retention of water and salt. Now, the presence of these two effects will further contribute to the worsening of the edema. Vasoconstriction will lead to hypertension. Now, the signs and symptoms will include cough due to pulmonary edema, decreased alertness or concentration due to cerebral edema, decreased urine production due to reduced cardiac output, difficulties in terms of sleeping, fatigue, weakness, faintness due to tissue hypoxia, irregular or rapid pulse, There will also be loss of appetite, indigestion, as well as abdominal congestion. Other signs and symptoms will include cyanosis due to impaired gaseous exchange, distended jugular vein due to venous congestion, nocturia due to fluid retention. Sensation of feeling the heart or heart palpitation will also be present. Shortness of breath with activity or after laying down for a while due to pulmonary congestion. There will also be ascites due to fluid retention. Apart from that, there will also be edema of the feet and ankles due to fluid retention. There will be weight gain due to edema. Orthopnea will also be there due to pulmonary congestion. Mental confusion and restlessness due to cerebral hypoxia. Okay?